To avoid stem cell therapy, or what are the contraindications of stem cell therapy? The number one factor is patient factor. The patient who is having bone marrow diseases such as leukemias, thalassemias, or aplastic anemias are not patients who can undergo stem cell therapy. Number two, patients who have got bleeding disorders, those who bleed a lot, they are also not patients who can undergo stem cell therapy. Disease wise, in grade 3 and grade 4 arthritis, chances of stem cell usefulness is very limited. Similarly, in grade 3 and grade 4 vascular necrosis, stem cells cannot be successful because basic structure of the bone should be intact for stem cells to be done. Thank you.